All of us experience loneliness, but we have different reasons why we are lonely. Some kids are lonely because their parent left them to work on other country to make more money. Some people are lonely because they suddenly lost their job. Some are lonely because they are not loved by the people they love. Some people are lonely because they lost in competition. Some experience loneliness because someone they love had died. How about you? What is the reason of your loneliness? Are you still lonely? How did you overcome your loneliness? I will tell you a story about Ms. Hantandi, a 39 years old who had a dramatic increase in body mass that most of her friends can easily recognize her. Her tummy bloats out, her legs turn big, her arms and chest expanded, her chin doubled, her cheeks enlarged, everything turns so fat. As days passed, Ms. Hantandi doesn't want what is happening to her. Her friends don't want to be with her anymore, no one wants to talk to her, everyone is teasing and bullying her. Ms. Hantandi started to eat alone, shop alone, almost all alone, and she started to stay away from people, especially to her friends and colleagues. Below is a sample of nursing care plan of Ms. Hantandi about her risk for loneliness. Assessment: subjective, I'm fat, so fat that no one else wants to be close to me. As verbalized by the patient. Objectives: frown face, anxious, weak, lack of appetite, increased emotional state, obese, weight is 200 pounds, height is 5 foot and 2 inches tall. Diagnosis: risk for loneliness related to fear of rejection secondary to obesity. Planning: after 4 hours of nursing intervention, the patient will report decreased feelings of loneliness and will identify the ways to increase meaningful relationships. Interventions: encourage Ms. Hantandi, the patient, to talk about her feelings of loneliness and their causes and encourage development of a support system. Collaborate with her existing family, friends, and neighbors to form one. Although her friends are one of the contributing factor of her loneliness, we need some of her friends who understand her situation to help the support system. Discuss her the importance of high quality, rather than high quantity socialization. Provide Ms. Hantandi some ideas to deal with her social concerns like volunteering for something she likes and be surrounded with the other volunteers that she shares common interest and they all focus on one common goal. Encourage the patient to activity clubs and other activities. Tell the patient to focus on her building 1 or 2 close friendships. Knowing that she have a couple of true friends who are always there for her can help her to deal with life's ups and downs. Encourage Ms. Hantandi to tell others how she feels, especially when she feels pressured or misunderstood by friends or family. Encourage the patient to write journal that gives positive statements about herself. Explain to the patient that letting her emotions to take over will only make things worse, crying and getting angry will only leads to loneliness and out of control. Refer Ms. Hantandi to impaired social interactions and prepare her for ambivalent feelings and short-term negative effects on her self-esteem. Refer the patient to a dietitian to help her with meal planning, weight loss, nutrition and her appropriate exercises. Evaluation: after 4 hours of nursing intervention, the patient reported decreased feelings of loneliness and identified the ways to increase meaningful relationships. There are other reasons that may lead to risk for loneliness, such as loss of a significant person, and the nursing intervention will be different from what we saw earlier. Remember that nursing interventions must lead to achieving your plan or goal. Other related diagnoses are anxiety and hopelessness. We have also videos of nursing care plans about and related to anxiety and hopelessness. For more samples of nursing care plan, you are free to check it out on our other videos. Just don't forget to subscribe to our YouTube channel, so you can easily gain access to different samples of nursing care plans. Just look at our logo above, then hit the subscribe button. Thanks. If you need samples of nursing care plans, you came at the right place. NCP Mania have a lot of samples of nursing care plans in different kinds of diagnoses. Are you a nurse or a student nurse? Having a hard time to create a nursing care plan for your patient, or as a homework for your class? This site helps you to create, improve, or give ideas in doing your own nursing care plan. What is more important is that it is all free. Subscribe to our YouTube channel now and gain access to our tons of samples of nursing care plan. Most people really hard to accept changes that suddenly appears in their life, because people tend to stay in comfort than to take the risk to move forward. We are fear and so afraid to accept adjustments. And sometimes people need a lot of time, like weeks or months, to accept and to adjust about these changes. That is why nurses are challenged to take care of these people who have impaired adjustments. It is really challenging on how a person will trust you and trust your interventions, especially if these people are not looking for a change or to modify their life. That is why the nurse must explain to the patient that these changes will result in a more favorable outcome and will not create more problems.